So listen. All right. So we've been talking about. We just mentioned that I'm not good at my health things, and so I actually I have to have a new implant put in, and I've been very scared about it. And there's a
Okay.
little, and so this tooth had to come out, and I have to say that the team over at ClearChoice Dental Implant Center was amazing in helping this all come about. We all know how important a great smile is, but we also know how important our teeth are to having good health. Well, there's some people like me who neglect their teeth, and now it's time for me to actually have an implant done. And I'm here with Dr. G of ClearChoice Dental Implant Center. Did I say it right?
You said it right.
Okay, I'm a little nervous because we're going to go through some of the process here that it takes to have an implant put in. But let's talk about how people get to the point of having to have an implant put in.
Well, there's different reasons that lead to needing an implant. A tooth that has a big cavity that cannot be fixed, a tooth that has a root canal that has failed, gum disease, or maybe even trauma, and you lose the tooth in itself. So there's different reasons why you would need a dental implant.
Yeah, and it's very important just to get checked out so you don't have to sometimes get to that point. But now that I'm at that point, we're going to have one put in.
Correct.
And this is very interesting because I was a little nervous, a little scared, and that's how a lot of people are. But here, you guys make everyone feel very comfortable, don't you?
Well, that's the whole idea. People don't want to rush in to get treatment done. But if you need to get it done, you need to make sure that you're working with a team that is empathetic, understand what your needs are, what your concerns of treatment might be, and help you get through with it.
Yeah. I think also what's very important too is that there's new technology, new things going on compared to when we were younger, going to the dentist. And that might have scared us to come in. But here, your team actually walks us through a great program here of getting a new implant. And that's because you want people to be happy with their smile.
Correct. You know, in the past, we could only use an X-ray, which is a two-dimensional image. Now we have three-dimensional X-rays that allow us to know exactly what the condition is, how to prepare, and how to solve the problem.
Yeah, your team's amazing. Your assistant, Paula, is actually going to take me through getting my teeth done. So what is she going to do for me?
Well, we're going to start with a few things. We're going to take the three-dimensional X-ray. We're going to take individualized X-rays of your teeth. We're going to use our scanner to obtain a scan of your mouth so that we can have you in a virtual setting and understand exactly how we need to place the implant. We're going to collect the information of the tooth that has the problem, but also of all the other teeth so that we can give you an idea of what the condition of your teeth is and what steps you need to take to keep your mouth healthy, as you said.
Yeah, what I love is that you've explained to me about the process. So the whole process is about 9 months, but it's not really like we think it is going, oh my goodness, I'm not going to have any teeth, it's going to hurt for 9 months, but that's not true, is it?
That's not true. In your case, it's going to take that amount of time because we need to do some preparatory work on the bone to be able to get it ready for the dental implant.
Yeah. Again, I go back to people being scared to come in, but here at ClearChoice Dental Implant Center, you guys are there to educate people more than to take care of their teeth in a way, I have to say.
Exactly. We want to make sure that you understand what the procedure is, understand what the oral surgeon is going to do for you, and understand what I'm going to do for you as a prosthodontist. It takes a team to be able to get you to a terrific end result.
Yeah. I know I'm just doing one tooth, but you could actually do a full mouth for people who have lost their teeth from different diseases or neglect. And that's one thing that's important there, isn't it?
Absolutely. I mean, if you have one tooth problem, if you have your whole mouth of problems, we can address it. The treatment that is prescribed is customized to your specific need. It's going to be designed to fit the size of your mouth, the tooth that it's going to be biting against, the tooth that it's neighboring. It's all made to fit you.
We're going to take a look at your teeth and confirm some of what we have seen on the X-ray.
Okay, Doc. How's it looking? What's going on?
Well, as we suspected, you have a tooth that's broken. The fracture is too big, can't be fixed. So this is the ideal situation where you get a dental implant to replace that tooth. We need to do a little prep work on the bone, but you're going to get a tooth that you're going to be able to chew a lot with in the future.
And like we mentioned, it takes about 9 months from beginning to end.
Correct.
And what I love too is that if I decide I'm out of state or I've moved out of state, I can always go to a ClearChoice Dental Implant Center nearby, right?
Absolutely. We have 85 offices throughout the United States.
I like that. Well, the information's right there on the screen. Let's get to work.
Let's get to work then.
All right.